many factors that contribute to it. People feel hopeless, self-loathed, isolated, stressed, anxious, emotionless, and guilty. When people have depression, it inhibits them from functioning on a day-to-day basis. Depression is a real disorder. So the next time that you think someone with depression is overreacting, think again.
Are you doing it? Getting busy? If you are, do it safe. Get yourself tested for HIV. It's safe, friendly, free, and it can save your life. Get tested week starts December 1st. So if you're doing it, do the right thing. Call 866-EXAM-HIV. That's 866-EXAM-HIV. HIV. Live with it. Get tested.
One of my favorite songs. Hi, Sister Cicely, how are you? Sing along, you guys.
I will not be shaken. I will never be defeated, 'cause I believe in my faith. Who are you to judge me based on what you think of me? I was born for greatness, yes, I will succeed in everything, 'cause I'm a survivor. I'm a survivor.
It's a man from South Africa. I can give you the information, okay? I should have wrote it down. I play it so much. I had it a long time ago, but I'll give it to you. Hi, Cheryl.
I'm a survivor.
I hope you're good.
I believe in destiny.
I believe in all of me. I'm a live. Whoa. It is a beautiful song, Lily.
I can never give up. No, I can never quit.
Never ever quit.
No matter what you've done to me, taking away my innocence. Whoa. Who are you to judge me? I don't answer
To the name of HIV.
I was born for greatness, and I will succeed in everything.
'Cause I'm a survivor.
I'm a survivor. And I think you'll overcome my faith in me. Oh,
'Cause I'm a survivor.
I'm a survivor. I believe in destiny.
Believe in all of me. Believe in yourself, you guys. Every single one of you guys. Believe in yourself.
I believe.
You were born for greatness.
I was born for greatness, yeah. Oh, 'cause I'm a survivor. I'm a survivor. And I think I'm overcome.
All right, you guys. Happy day. This is Positivity Discussion. You have to remember that HIV exists. You have to get tested. You have to use protection. And if you have contracted HIV, you can get on medication and you can live a better, healthier life. So today we are going to chat it up with Murray Penner. Murray Penner. He's the U.S. Executive Director for Prevention Access Campaign. And we're just going to discuss, a little bit about his life. And then we're going to discuss the beginning of the pandemic, the HIV pandemic, because he was part of that era. So I'm going to go ahead and I'm going to bring Murray Penner on. Hey, Murray.
Hi, Dee.
It's so good to have you on.
Thank you. It's good to be
More
here.
people need to come on and talk about what they've been through in the journey. So many people don't want to talk about it. And if there's something you don't want to talk about, you just tell me, just please move on, Dee. I don't want to talk about that.
Okay. You got it.
So tell everybody who you are, first of all.
Oh gosh. Well, I don't like to talk about myself, Dee. So this is going to be a challenge, but so yeah, I am. You already know my name, Murray. I grew up in Newton, Kansas. It's a small town right in the middle of the country, near Wichita, Kansas. If you've heard of Wichita, about 20,000 people in the town. I had a high school class of about 200 people, and I was a swimmer in high school.
What?
Yes. I was a breaststroker. Swimming was my sport. So I went all the way to the state championships my senior year and finished second by just a touch. I mean, the guy that beat me out just like touched ahead of me, and that was kind of crushing. I thought I was going to win. So, but I guess that's do what?
Were you in high school then or college?
I was in high school. It was no, when I got to college, I think if I would have won, I might have gone on swimming in college, but I was kind of like done. I was like, So
who is Murray Penner, and what about the people in your life, your family, your friends? How would they describe you?
Well, maybe what I'll do is just finish a little bit more about like growing up, who I grew up around, and then I'll just go into sort of how they might describe me. Okay. My mom and dad are still living. They still live in Newton, Kansas, where I grew up. They're in their 80s and in pretty good health. So they're obviously really important to me. I have one sister. She is 2 years younger than me, and she is a superintendent of schools in Northwest Washington State, like up in the Olympic Forest. She's a superintendent of schools up there. She's married and she has one son, so I have one nephew. And she and I are also very close. In fact, just a couple of years ago, we trained and ran a marathon together, in New Orleans. So she's up there, I'm here, we're training at the same time, and then we come together in New Orleans to run this marathon together. And guess what? She was so much better than me that we got about halfway, and she's like, I'm going on. See ya. She left me. So I give her hell about that all the time. So anyway, I grew up, that was sort of my family of origin, if you will. And then I met a guy in college, and we got hooked up. We couldn't get married at the time, but we lived together, and we were together for 24 years. His name is Blaine. And we together adopted kids in 2000. And so I have a daughter who turns 21 on Monday, actually. And we brought her home from the hospital on her birth, when she was born. And then my son's name, well, I didn't say her name. Her name is Bailey. And my son's name is Chance. He is now 24, so he's a little bit older. But we adopted him at the same time that we got Bailey. So we kind of had like two kids right at the same time. They're not the same age, and they're not biologically related, but the kids are all obviously very important to me. In fact, my son is living with me again now for a while. He and his girlfriend are living with me, so I get to see him all the time. But my daughter is out in Seattle. I'm in Washington, D.C. Anyway, I'm rambling, but
Okay.
those are the people that are most important to me. I'm single, so I am no longer in a relationship. I've been in a couple relationships since, and I'm actually pretty close to all of. Well, no, I don't have that many exes, but my couple of exes. I mean, I'm a gay guy, obviously, and if I didn't say that, it's maybe kind of obvious. And they're still in my life too. And I think that to answer your question now, finally to answer your question, I think they would say that I'm kind and generous and supportive and helpful and loving. And that I would do anything for them. That's sort of kind of how I live my life. I feel like, I've had a lot of privilege in my life, and I feel like I got to give back to not only those people that are important to me, but others. And we can talk about that later. But I'll stop there and see if you have any questions.
Well, I think that describes you pretty well, because I believe and I feel that you're a really loving man. You're a very loving and caring man. There's so many people in this field who have such big hearts, and you're one of those people who have a big heart. And I think you're kind of sensitive too, in a way.
I'm very sensitive. I don't like to admit that one, but yeah, when there's criticism, whether it's of me or something that I've done, or something that I've worked on, yeah, I'm pretty sensitive.
Yeah.
I try not to cry very much, but I do cry.
Let's because we're on here to talk about your journey during the beginning of the HIV pandemic, and people who live with HIV. A lot of us know already, what went on back then, but people who are HIV negative, they don't seem to understand about this whole HIV pandemic in the beginning. Go ahead and talk a little bit about the beginning of the pandemic. Did you know about HIV back then? And did it start with you having maybe friends, or you've seen on the news that people were dying from this AIDS epidemic?
Yeah. So, I mean, just to put it out there to start with, I was diagnosed with HIV in 1986. In fact, I just passed my 35th year. I just got to my 35th year on March 11th. So it was 35 years ago on March 11th that I was diagnosed. And it was really weird how I found out. Prior to that, I had applied for life insurance. And, when you get a life insurance over a certain amount, they do blood work, right? So they came to my house and drew my blood. And a couple of weeks later, I got this certified letter in the mail. It said to be opened only by addressee in red letters, and it was confidential and blah, blah, blah all over it. And I'm like freaking out, when I get this letter.
Yeah.
So I was afraid to open it. The address didn't let me know that it was from the insurance company. I don't remember what it was, but I didn't know it was from the insurance company. So I'm like, what the hell is this? So finally I opened it, and it basically said, you have a life ending medical condition. See your doctor immediately. So, but it didn't say what it was. And so I'm like totally freaking out. And I at the time I was living in Oklahoma City, and, there wasn't the internet. So there was no, I couldn't go online and try to figure out what's going on, or And, you know, so the only news we got was like either in a newspaper or on TV or something like that. And I had heard about, it wasn't called HIV then, but I'd heard about it, but I didn't think it was going to affect me. You know, it was about San Francisco and New York.
When you received it and you read it, did it even dawn on you or click that really?
No, it didn't. Although, you know, then I started thinking, well, what could this be? What really could it be? And then I started doing a little research. I don't remember exactly. I think I probably went to the library because that's what you used to do in those days. You'd go to the library to try to, you know, find out the most recent news. And I read about AIDS, but I still didn't think it was. I didn't think that's what it was. And it took me a really long time to even tell my partner about it. Finally, I told him about it. And he's like, well, I think we need to go get tested. We need to go get tested because we were still having unprotected sex. So, you know,
he's the one that initiated
that
you should get tested.
Yeah. So we went to the health department and got tested. And of course, in those days, it took, I don't remember, 2 or 3 weeks to get your results back, right? You couldn't just get them rapid tests like you can do now to find out what's going on. So I had to wait, came back, went back in the morning on March 11th. And the doctor, you know, took my partner into one room and me into the other room. And I came out and I was white. My face was white from just like, you know, all the blood had drained out. And he was fine. So he's HIV negative. I'm HIV positive. And the doctor told me, you know, this is a real serious condition. We don't really know how to treat this because in those days they really didn't. I mean, they had some treatment, but not very, very much. And he said, you better write your will. Talk to your family because you'll probably be gone in 6 months.
And you know, that's tough because you're not the only one who in the beginning of the epidemic has said that they've told people to prepare for their life to end. How did that affect you? Did you think you were going to pass away in 6 months?
Well, yeah, I mean, it was devastating to me. And you know, so I was working at the YMCA at the time, and I was not out as a gay man, let alone out as HIV positive, you know. And we had our own self-insurance. So the insurance plan and everything was within the company. And I was afraid to go to the doctor because I was afraid that they would see my diagnosis on the insurance and that I would lose my job over it.
Right.
So I didn't go to the doctor for a really long time. It was about a year afterwards that I went to the doctor. I mean, it was like there was no real reason to go because they told me that I didn't have much time to live. So I was kind of like just really in despair about it. So finally, I started reaching out to an organization that's not in existence anymore called Project Inform in San Francisco. And they had a hotline. I found it through a newspaper or something, and I called the hotline, and they sent me a whole bunch of information in the mail. Of course, you know, it took weeks to get it and all that kind of stuff. But I got the information, and I started reading up a lot about it. And finally, I got up enough nerve to go to the doctor, and she was amazing. She had a support group for all of her patients because there weren't really a whole lot of services. And so she had a support group for all her, she called us her guys. She had a support group, and we got together every Wednesday night, and I started watching everybody that was in my group die. And, you know, and then I got more involved with volunteering at the it was called the WINS housing. It was housing for people who were dying, essentially.
So
and that's what did. You know, that's what we did then.
So it was a whole year before you reached out to anyone. By then, when you reached out, did you get on meds right here? Because back then it was AZTs.
It was AZT in the very beginning, and then they added DDI and DDC, but I did not start on the meds right away. You know, in those days, they didn't talk about about your viral load. It was about your CD4 count. That was the measure. And my CD4 count was about 400 when I was diagnosed. And then it started dropping. And in 1991, it dropped down under 200. So I was on, you know, all the preventive things for opportunistic infections to keep me from getting pneumonia and stuff. And that's when my doctor wanted me to start on AZT. And that's also when you took AZT 4 times a day and you took a heavy dose 4 times a day. And I just told her, I said, I can't take that much medicine. I can't do it. Because I was watching all my friends get sick from it. So I didn't do it. I didn't do what she wanted me to do. And I think that's what saved my life, honestly, because I think all that medicine in those days, you know, just killed people. Really, honestly, it's like poison.
So tell me this: I did a lot of reading, you know, on AZT, and when I was reading, it came up that AZT was a medication for people who had cancer.
Yeah.
And so I guess they thought that they figured out that it was going to help people who live with HIV. I mean, what they call it back then, GRID.
Gay-related something disease. Yeah, immune disease or something like that. Yeah, immunodeficiency or something. It was GRID. Yeah, for sure.
Yeah, so it just makes me wonder how they thought that was going to help.
I don't know. I remember hearing about it. I remember them saying, you know, they found this medication basically on the shelf, right? But we heard about that during COVID. We heard about them saying, oh, these drugs might work on COVID, you know, so drug companies do that to check it out. And, you know, I think AZT is clearly important in mother to child transmission, right? I mean, the early trials were all about AZT and the role that it could play in preventing infection. So it clearly did something. It clearly did, you know, something to help people. But I only took it once a day. I just couldn't take it 4 times a day.
So you did take the AZT, you only took it once a day.
I made my own dosing, you know? Yeah.
And I'm wondering if a lot of other people did that as well. Just wondering. I know there's a beautiful advocate by the name of Nancy Duncan who said she wouldn't take it at all because she was seeing all of her friends and people just pass away. It's frightening. I can't even imagine, Murray, even having to go through that back then in the 80s. Tamisha says to you, good for you, Murray. You started advocating for yourself and not even knew that's what you were doing.
I didn't. You're right. I had no idea what I was doing. No idea. I mean, I was, you know, flying blind and really just, I mean, it was because of what was happening to everybody else, I think, that I was like, I can't do this. I mean, you know, I really went for probably 20 years every Christmas thinking it was going to be my last Christmas, you know? I mean, even after I got on antiretrovirals, you know, I was still in that mindset that why am I here? Because, you know, me and a couple of other friends are the only people left from my whole group of friends that were involved with my daughter's support group. You know, there's a couple. Do what?
The regret that you're still alive.
And I felt guilty.
You passed away.
Yeah.
How many people that you were close to that lost their lives?
I mean, all of my good friends. The person that I know I was infected by, and I hate the word infection, but I'm going to use it in a couple of instances like that, just to, because that's what it was, especially
back then.
especially then. Yeah. I was with him when he died. He called me to come. He lived in Albuquerque and he was with his family. That's what a lot of guys did when they got sick. They went home to be with their family to die, because there weren't very many places. There were even places that wouldn't like rent to you and stuff like that. I mean, people looked, if you've watched there's several shows, several movies and series where you can see people, and the way they portray with the lesions and the really, really, really just emaciated looking. Yeah. That was real. And I saw so many of my friends die. I at one point kept track of the names of people that were dying. And I stopped after it got into the hundreds because, there were so many people that were dying. It was a funeral all the time. And I was in Oklahoma City, and Oklahoma City was not like New York City or San Francisco, where it was like way worse than that.
So that's really stressful to try to keep up with people who are passing away. I don't think I would be able to do that.
It was very traumatic. I think we all probably know someone during COVID that's passed away, right? And some of us way more than just one or something like that. And so that's how it felt. But I would say that the difference was we didn't really know very much about HIV. We really didn't. There was not very much information about it. And with COVID, yes, I know we're learning as we go, but we know what it is, and we know, how you get it, and we know what illnesses you get, and we know people can die. So there are a lot more things that about COVID than we did about HIV. All we knew was that people were dying from it, right? That was it's traumatic, and I go through every World AIDS Day when it's about remembering, and it's a really hard time for me. And the holidays are really hard too, because I still have that. I wonder if I'm going to make it another year. So the winter and the the holidays and everything are really hard times for me. I go through a lot of depression and stuff.
So when it came to the AZTs, how long were you on the AZTs once a day?
So I did that for a couple of years, and then my doctor added DDI and DDC. One of them, I don't remember which one, was a powder, and you had to mix it with water, and it was disgusting. So another reason why it was just like, the meds were so horrible.
One that you told me about. I've never heard anyone talk about the powder that you had to mix with water.
Yeah, it was disgusting. But I was, I had a really good doctor. She was amazing. I wish I could find her now. I'm friends with her on Facebook, and I've sent her a few messages, but I don't think she's very active. And so I don't know really how to get in touch with her. I'd really love to talk to her and tell her that I didn't take her advice and I'm still alive. But, that whole time, gosh, where was I going with that? Oh, the DDC. And DDI. So she added it, and then she got me into a clinical trial. And that clinical trial was the very first protease inhibitor that was approved in 1996. It was a Merck drug. I think that's also what saved me, is that I got into a trial before the drug was approved, because a whole bunch of people were still dying in that time frame.
And when I hear people talk about the protease inhibitors, I always tell myself that I contracted HIV right at the tip of the AZTs disappearing and the protease inhibitors coming out, because I was on protease inhibitors and I was sick as a dog. I was sick as a dog, but I wasn't on AZTs, so I can't even imagine how hard it was for people to be on AZTs. People just, they wanted to live so bad that they were willing to try it, and I don't think they realized that it was actually killing them.
Yeah.
And it was too late for them to turn back once it got bad.
Yeah.
I always say
Well, and
anybody
people were
to live, right?
say what? I'm sorry, I was
I
talking
said
over
anybody
you.
that anybody will try anything to live.
Yeah, for sure. And like my friends were getting all kinds of weird diseases and stuff, all the opportunistic infections. There was histoplasmosis and toxoplasmosis, and there was the Kaposi sarcoma, which was the pneumonia. There were no, Kaposi sarcoma is the skin cancer, but pneumocystis pneumonia. I'm getting it mixed up a little bit, but there were all these opportunistic infections that everybody would get, and a lot of them had thrush in their mouth, which is that really, it's almost like kind of like mold or something. It's disgusting, also, and people's breath would smell really bad. So it was horrific, and I was so blessed that I actually got into that trial, because I think that's probably what saved me.
There was a woman named Diane that I know who in the 80s contracted HIV. Well, back then they called it AIDS. And she almost died. I mean, basically almost died. And they wouldn't even put her in a clinical trial because she was so sick. There was a doctor who put her in a trial anyway. And if it wasn't for that doctor, she wouldn't be here today. She's still alive. So,
Wow, that's a great story.
The doctor gave her a chance and did it anyway. And she's still here. Let's see. Aaron says, yes, Providencetown had the same setting in the mid 90s. They would even save the meds of patients that had passed to give to other people that needed them. Oh, wow.
Yeah.
Oh, wow.
That's exactly. I remember that, Aaron. The same thing. It's like, especially when AZT and then DDI and DDC, and there were a couple of others that were starting to get approved that weren't protease inhibitors yet, but there were a couple others that were starting to get improved, and people would die, and the medicine, sometimes the family member or whatever would give it to either someone else or give it to an agency, and Dee, you know this, but in the early days of COVID, one of the things that I felt was really important was to help make sure people could get their meds. And I had people sending me meds. It was just like those old days.
You did amazing.
I know that's illegal. I know you're not supposed to do that, but that's how we save each other. And you're right, Aaron, again, it was really scary.
Scary. I can't even imagine. I can't imagine, Aaron Murray. I really can't.
I mean, think about what it was, when COVID was really, really getting bad. And all of us were like kind of freaking out about it, So.
Yeah, you did a lot. You did a lot. A lot of us reached out to you so you can help people get their meds. A lot of us reached out to you. I know a couple of people in Dallas who was supposed to get their meds delivered. Something happened, COVID hit, and they ended up not getting their meds. And that's not good. There was a mistake with the pharmacy or what have you. So I think they were off their meds for like a month. And I kept telling them, well, I can reach out to somebody. They're like, no, it's a month. Yeah, hopefully it'll just be a month. If it goes longer than that, I'll let you know. But I guess when you've lived with HIV for so long, you tend to not be petrified anymore when you run out of meds, But
I feel so privileged and so blessed, because I don't think if I ran out of meds, I don't remember running out of meds. I've always had access, and I'm also pretty I don't know, pretty ritualistic. So I take them every day, and that's why U equals U works for me so easily and so well, because I'm very adherent with my meds.
Yeah, there was a time when that's why we always say self-care. So we have to take care of ourselves. And sometimes we're so busy taking care of everybody else that we forget to take care of ourselves. And I did that probably about 6 years ago, because I had a sister that was passing away and she was in the hospital. And me running back and forth to the hospital and dealing with her teenage daughter. I missed my doctor's appointments. I would pick up my meds. I was off of my meds for about 3 months. My T cells shot down from about 1100 and something all the way down to almost, I think it was a little under 4 in 3 months. And I know that was because of the stress that I was dealing with. So, and I was undetectable for a long time. It's like now I have to start all over again. But self-care is important. We have to stay on our meds. It's so important for us to do that. We must stay on our HIV medications, you guys. Everybody who is listening, please take care of yourselves. Take care of yourself. Now, Murray, let's talk about, because you are the U.S. Executive Director for U equals U, but you weren't always the U.S. Executive Director for U equals U. So, how did Murray get into working in the HIV field?
So that's a great question, and I think somebody in the chat earlier put in something about, I didn't even know I was advocating for myself. So I was working at the YMCA. I told you that, and one of the things that we had to do as part of our YMCA work was we had to do volunteer service in the community. And so I got involved in HIV, in like I was saying, volunteering at the house, the resident's house. There were support groups that I started volunteering for. There was a program that I started trying to lead that program. So I did a lot of volunteer work in Oklahoma in particular. And then my partner and I moved to Texas, which is where we adopted our kids. And I got involved with the Ryan White Planning Council, the planning group. Then a position became open with the Ryan White program in Fort Worth in Texas, and I was hired for that. So that got me in now I'm working in HIV, right?
Right.
And then my partner and I moved to DC, where I am now, and that's when I started working at an organization called NASTAD, the National Alliance of State and Territorial AIDS Directors, and I was there for 18 years. At the very end, I was the executive director of the organization. And then I felt like I needed to do something more impactful. Not that that wasn't good work, because it was really good work and they do good work. But, I'd met Bruce Richmond while I worked at NASTAD, and I was really excited about U equals U. And he and I got started talking, and it just sort of worked out that I landed here at Prevention Access Campaign. So it was an evolution, and it was also something that I didn't plan to do ever. I never planned to be doing what I've done nearly all of my career. I planned, when I was in college, I was majoring in botany, which
Really?
plants. I wanted to be a landscape architect or something like that. And I really know my plans. I know, all about that. So, yeah.
Oh, I can see you. I can see you dabbling in that.
Yeah. So, but then the other thing, I changed colleges, and when I changed colleges, the other thing that I was really interested in was helping people, and so I got a social work degree, and then that led me into the YMCA, which then, I've told you the rest of the story. So. The social work degree, I think, going back to what you asked me about who I am and what people would say about me, I think people say, you know, he likes to help people. He would help anybody. And sometimes, to your self-care comment, sometimes not taking care of himself and taking care of others first.
Yeah. I think that's what advocacy and caring about other people, I guess, is about. So many people who have a big heart, they don't realize that I call them caregivers. We're caregivers. And we don't realize sometimes that our caregiving, it goes to the extreme until we start to wear ourselves down. And then we're like, okay, I need to take a break. Um, Caregivers just keep going. We just keep going. We're caregivers.
Yeah.
And
True.
I think we're created. A lot of people don't like to talk about, God, but God created people to help other people. That's why we're created. I really believe that's why we're created. We're created
Well,
to
if you
give
believe,
back and to help.
if you believe the Bible, the
Yep.
Bible and Jesus, you know, that's what Jesus did.
That's what we're here for. And that's why there's so many amazing advocates in all kinds of different areas, not just HIV. There's so many amazing advocates in the world. Murray, what would you tell people who are struggling that live with HIV?
Oh, I get asked this a lot, and it's a hard question because it's so personal to everyone, and everybody's experience is a little bit different. I think I'm just seeing something in the chat about learning from each other. I think
All different times, so we can
the
learn.
thing that I would say is lean into someone who you know is in your life and look for that support, because you really need someone to share the journey with. And it is a journey. Especially when you're first diagnosed. I'm going to tell a story about I won't make it too long, but I'll tell a real quick story about someone that I recently talked to when they were diagnosed. It was last year. It was during the pandemic. And I got a text from a friend of mine who said his best friend had just been diagnosed. He'd gotten his diagnosis at an urgent care center. Can you imagine going to an urgent care center for whatever you're going for, and you find out you're HIV positive?
Wow.
And the doctor basically there said, well, find a doctor. Here's some materials for you to read. And it was a terrible way to, it was a terrible way to find out he was HIV positive. Anyway, his friend is my friend, and he hooked us up, and we spent like hours talking. And, the first thing that I would tell someone who's newly diagnosed is you're going to be okay. You have some responsibility, but you need to get into medical care and you need to get on meds, and you'll be all right. That's why I'm here right now. I can't imagine all the number of pills I've taken over my lifetime, but that's why I'm here.
Over 30 decades. Over
3 decades, not 30 decades.
Over 30 years.
Yeah. So, I would say, get as much support as you can, and you have to ask for it, and you have to, really seek out somebody or numbers of people to help you, because it's not easy. You got to have somebody to lean on. And I would say, it's not sometimes easy to find services and get your insurance and all that kind of stuff, but I'd say work on that too, because there are good programs, and find somebody who can help you get to a place where you're getting help on all of the kinds of things that you need help for.
I agree, Murray. I agree. You have to connect with people who can help you, who've been through it and can guide you. So yeah, I agree. I want to just talk a little bit before we go, because we have about 15 minutes. I want to ask you, what made you want to start in, how am I trying to put this? Start in working or talking about you equals you. How does it make you feel? Do you have any stories of other people that you've reached out to when it comes to you equals you, and how has it made them feel? And why do you think it's important for us to continue to keep talking about this liberating message?
Yeah. So, I think, well, I'll back up just a little bit. So when in 2008, there's a study called, and that was published, and it was called the Swiss Statement on HIV, and it was in 2008. It came out and it said, if you take medication, you don't transmit HIV through sex. And there was something about STDs in it as well, which was, you couldn't have STDs either, or at least in that study, something like that. And so I was like, wow, wouldn't that be great if that was true? But I didn't believe it, I didn't believe it because it seemed really wacky. And it's like, oh, it can't be, this is this terrible disease. And so I was really caught up in the stigma myself about what it was. And, I felt dirty, and all that kind of stuff. So, fast forward a few years, and then they started doing these studies, and I was following the studies, but then Bruce contacted me in 2016. We met on Facebook, actually. He hit me up on Facebook, and I was like, oh, he's kind of cute. I'm looking for a husband. Maybe he could be my husband. So
it worked out that way, though, right?
But anyway, he started talking to me about, at the time it wasn't really even named yet about you equals you, and they were just writing the consensus statement and all that kind of stuff. And so at that point, when he told me, I was like, I don't believe this. But then I started really studying about it. I'm like, this is really true. And I was the director at NASDAD at the time, and Bruce wanted us to sign the consensus statement. And I was like really nervous about it because it was controversial. It's like, what? Really? No, we can't tell people that. And so I asked my staff, and they were like, well, if it's true by the studies, why would we not embrace it? And I was like, well, I want to embrace it in my life. And now I kind of got the blessing for the organization to endorse it. And I'm like, okay, I'm all in. I'm going for this. And when I decided that it was real in my life, it was like really freeing to me. I mean, what people ask me when they ask what you equals you means to me, it's like, it means freedom and it means hope. Because it really freed me from that really awful feeling that I was dirty and that I was going to give it to somebody, and, all those kind of terrible things that we think about. I had great support, by the way. My family, my friends, everyone has been really supportive. And so I was very fortunate for that too. But it was really freeing. And, that's what I want to tell people. I know a lot of people are suffering, they're depressed, they're sometimes suicidal, there's lots of things in people's lives, and HIV may not be the only reason, and probably isn't the only reason, but it's a pretty depressing thing if you don't have that hope and you don't realize that you can actually, take care of yourself. And, in the process, kind of shed all that stigma and fear and worry that you have about having sex, because then you feel bad about having sex. So you're not having good sex, and it just compounds. Right. We got to have good sex, right?
It's uncomfortable. It's very uncomfortable.
Yeah.
Yeah. Very uncomfortable.
So it's just freeing. You equals you is freeing, and it takes some work to get there for some people, and it takes an ongoing commitment to your treatment. That is central to it, but that's not who we are. That's not our lives, right? Our lives are so much bigger than HIV status and what our lab tests say, number CD4 count, if we're undetectable or not. Not everybody can get there. Not everybody wants to get there, honestly. I mean, I don't know why you wouldn't, but some people make that choice, and that's okay. They might take medication once in a while, but I don't know.
What about the barriers that we always talk about that people face, and then people who don't want to share U equals U because they said they have to focus on the barriers first?
Yeah.
What do you say to that?
Well, what I say to that is we need to use U equals U as the advocacy to get the barriers removed. I mean, it is like the U equals U is so powerful. Not only does it keep us healthy and, our well-being, really good well-being, etc., but it also means that we're not passing on HIV to our partners. And so we're preventing new transmissions. And so it's very, very powerful. That U equals U message is so powerful that it has the power to get those barriers gone, to get more money into treatment, and to help. There's 400,000 people in this country who are not virally suppressed, and or they're not in care. They're just, they're struggling. And, I think the reason why U equals U is here now, yes, we need to keep telling people individually that it can help them and all that kind of stuff. But we also need to be using the message to break down the barriers. So the message comes before the barriers, which means doctors need to tell their patients, need to tell everyone about U equals U. There's even some really great studies that show that people's well-being improves when their doctor talks to them about U equals U. Their viral load, they become undetectable quicker. Their personal well-being, even societal stigma starts to break down. So there's so many reasons why everyone needs to know, so we can all use that as advocacy to get rid of the barriers, to make more culturally competent programs so people feel safe going in to see the doctor or whoever they're seeing, So we need to be educating, and that means providers can't say, oh, well, I don't want to give them this information because they might not take their meds anymore. There's so many excuses we hear.
So many, but the U equals U message is a global message.
It is.
Global message. And it actually is saving the lives of people who live with HIV, even in other countries. So I just say it's a global message. And as long as we keep talking about it and keep sharing it, more and more people will feel more comfortable with talking about U equals U. It's funny how when treatment as prevention, and that's all they talked about. And I know a man who used treatment as prevention, him and his wife, to have children. They had one child through sperm washing and the other two through treatment as prevention. So it's letting us know, U equals U is letting us know that we can be in loving relationships and people can have beautiful families because of this. Why are people fighting it now? They weren't fighting it then. It's the same. It's. How can you see a difference? Do you understand what I'm saying?
Oh yeah, I mean,
science. You can't say you don't believe in U equals U because this is science. The science is right there.
Oh yeah, there's, I mean, the four major studies that proved U equals U, there were zero transmissions in those 4 studies. And, I mean, that's it right there.
Yeah. Yeah. Well, Murray, thank you so much for coming on and
It's been great
sharing your
talking to you.
lovely journey. A lot that people didn't know about you, A lot of people didn't know that it's been, what did you say, 36 years?
35 years since I was diagnosed. And it was probably a couple of years earlier that I'd actually acquired HIV.
And he's still here, and he's still standing, and he took his AZTs once a day, not 3 or 4 times a day, and he got in a clinical trial, and he ended up on protease inhibitors, and here he stands, the wonderful, loving Murray. And I'm so glad, I'm so happy to have you in my life. A lot of us are so happy to have you in our lives. Continue to keep doing what you're doing. We love you so much, and thank you again for sharing the part of you that people didn't know about.
Thank you, Dee. Love you.
Well,
I'm honored to be on your show. So thanks for having me.
thank you. All right, everybody. Say bye to Mary. Bye-bye, Mary.
Bye, everybody.
Oh, Aaron says thank you very much. Real quick. Thank you. Thank you. Very nice to hear your story, Murray. Love you for doing it. Oh, you're welcome, Aaron. Okay, Murray. Okay, everybody. That was a great show. It was a great show. It's nice to listen to other people's journeys. And that's how my show actually started, was through internet radio. And I allow people to come on, share their journeys, talk about how they got over being diagnosed and where they're at now. And it was, for me, it was an easier show, I can be honest, because a lot of people don't want to share their face. A lot of people don't want to share their names. And they would come on internet radio and they would talk I would never ask anybody what their name was. We just chatted it out and it turned out really well. Let me see, Lisa, you say what? One is the science and the other is the liberating campaign. Right. Where we go from oppression to operating in the cycle of liberation. I love how you put that, Lisa. I love how you put that. All right, everybody. So I always say I put these plugs in, but it's just information that people need to know. So if you are looking for testing or know anyone else who is looking for testing for any STD, you can go to hiv.gov, hiv.gov, type in your city, state, or zip code, and guess what? It's all going to pop up on that little map, and on the screen on the right, you get to click where you want to go that's near you to get those things done. If you want to know about a great organization for women that is online, it is called the wellproject.org. The wellproject.org. You can go on there, you can read a lot of articles. There's so much information for women there who live with HIV. There's a lot of support on that website. If you want to know about the HIV criminalization laws in your state, you can go to the Center for HIV Law and Policy, hivlawandpolicy.org. hivlawandpolicy.org. Again, type in city, state, or zip code, and guess what? They're going to give you the information for the HIV criminalization laws in your state. Every person who lives with HIV needs to know these laws in their state. If you want to know more about U equals U, what equals U is a person who lives with HIV stays adherent to their medication, which is undetectable, which means virally suppressed. We can no longer transmit HIV to our partners as long as we stay on our medication. You can go to u-u.org, u-u.org. All right, everybody. This is Positively D Discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. And if you have or know anyone who has contracted HIV, they can get on medication and they can live a better, healthier life. Thank you so much. And I believe I'm going to have on Janelle. She was on, I believe last year, a year and a half ago. She was a woman who did not live with HIV. Met a man who lived with HIV. They got together. She talked him into getting on his meds. He got on his meds, but guess what? They had sex too soon before he became undetectable. And Janelle contracted HIV, but they're living a beautiful life with beautiful children. And she's going to be on the 27th of March, and I can't wait to see her and have her on again. Everybody have a great, awesome, and amazing Saturday, and I will see you next week. Bye-bye.